All right. Also going to start my video so you can see who's presenting. My name's Tom Bartholomew from Rutgers University, and I'll be your pilot for today. And my wingman is a man who needs no introduction. Well, maybe he does, Joe Berkman. And he'll be our color commentator and also manning the chat. This presentation is part of a series. We think of it as the second topic, the restorative function of clinical supervision. But if you have the opportunity, feel free to join us for some of the other sessions where we talk about the other functions of clinical supervision, as well as issues of implementation. All right, so what we're going to try to do in this hour we have together, the first thing is we're going to describe what is restorative supervision and its relationship to burnout prevention, which is, I think, important to all of us. And particularly during this time of COVID-19, this presentation is more poignant. It's actually my favorite presentation in the series. So you're in for a treat, I hope. The second objective is we're going to talk about activities that can serve as restorative interventions in clinical supervision. And there's no right or wrong for which interventions a supervisor uses, but we'll give you some examples of stuff we use. And then the last objective is try to understand the relationship between reflective practice, which we'll describe, and the restorative function in clinical supervision. So I'd like you guys to take advantage of the chat function. And I know we have some folks on the phone, so I apologize for you. I don't think you're going to have this capability. But what I'd like folks to do is list one self-care strategy that helps you in your workplace, in your work, and then one self-care strategy that helps you at home. And Joe's going to man the chat and just give us a sense of what's coming in. And we'll save this chat and send it along with this PowerPoint that you'll get at a later date. And the reason that we're talking about these self-care strategies is that they have a lot to do with restorative supervision and what that entails. Okay, so we're just going to keep going, and we'll get back to Joe in just a bit. But if you can, go to the chat function and just address those two issues. What's a self-care activity at home, and what's a self-care activity at work? So the functions that I was describing in this series on clinical supervision come from a woman, it's often called the Proctor model, Bridget Proctor from England. And she coined these terms restorative, formative, and normative to refer to what are clinical supervisors supposed to be doing? Like, what is the function of clinical supervision? And so we'll talk a lot about restorative supervision today, but the other two functions, the formative function is helping somebody form new skills and attitudes and the capabilities required for a professional within the field. So it's the formation of new skills. There's also teaching and education function. And she talked about the normative function as the accountability function in clinical supervision. And these are, are people showing up on time? Are people doing their job and maintaining an orderly, efficient workplace environment? And interestingly, people may have heard of Alfred Kadushin, who was a grandfather in social work and wrote a very influential textbook. And 17 years earlier, he identified three functions as administrative, educational, and supportive as the functions of supervision. And those are the same functions that Bridget Proctor, 17 years later, coined restorative, formative, and normative.
And speaking of restorative,
yeah,
these guys are doing some really great things to provide self-care for themselves.
Give some examples, Joe.
They're taking breaks. They're standing and stretching at works. Maybe they have one of those special desks you can stand up and work. Actually, someone mentioned a fun team meeting. that they actually try to make the team meetings
Ah,
enjoyable to talk about providing supportive stuff, I guess. Short walks was big on the list, both at home and at work. Fun things at work, walking the dog, cooking, yoga,
you mean it? Yeah,
just
I'm thinking.
connecting with family,
Yeah,
and soccer. So
nice.
yeah, so people have some interesting
It's great.
interesting ways. It really is. Yeah, it really is good. Now the real important thing is to not only identify them but make sure you do them too.
Absolutely.
But that's great.
Yep.
Thank you for your input.
Okay, so I mentioned it's three functions: restorative, formative, and normative. And if we were together in a room, we would be reciting these over and over, and you'd get sick of them. But restorative, formative, and normative. And in fact, if you take nothing else away, that would be a good take-home idea. And it was something that really helped me as a clinical supervisor, just to think in terms of those three functions. But what writers in clinical supervision talk about is the unavoidable tension within clinical supervision of the need to be supportive of staff and promote psychological safety within supervision, and at the same time hold staff accountable for the work they do and attendance and record keeping and paperwork and things like that. So this tension is really unavoidable, and it's part of the work of clinical supervision is to figure this out and make your peace with it. So let's talk specifically about the restorative function. This function in supervision encourages and supports emotional processing of what goes on in our jobs in mental health, and as well as reflection and self-care. And it seeks to support personal and professional growth. And we're going to talk about that as two sides of an important equation that you're expected to take care of yourself at work, but also at home as well. And the promotion of professional growth. This idea of reflective practice, of being given an opportunity to think about what it is you do and how you feel about what you do, and whether you could do it better, is really critically important. It's a big part of restorative supervision. And this also includes team building. And so I've found that a focus on restorative supervision and these things I've just been talking about tends to have the effect of building teams, because people are talking about how they take care of themselves and what they struggle with, and clients that they find have challenging behaviors, and how it feels to work with them, that kind of thing. So this function can also build resilience, and I'm going to present a model in a little bit that I learned just a few days ago, which I just love it. And it comes out of the University of Pennsylvania, called the PERMA model. And so also the restorative function is one of the best weapons against staff burnout and the dangers that exist in working in mental health. So I'm going to give you a pro tip. We got 3 of them or 4 of them coming up. So if possible, if you can address that tension in clinical supervision between psychological safety and accountability, if you can separate that, I would encourage you to do so. Now, most agencies, you can't do it. They're too small. We're fortunate within the state psychiatric hospital system in New Jersey that we can do that. So I supervise people that I am not their administrative supervisor. So I don't have an accountability function in the same way. And it just makes it easier for me, I find. So that's pro tip number 1. We'll review them at the end. So this brings us to this fork in the road, which really is asking the question, why are we doing restorative supervision? What's the point? And I like to think about it as analogous to this idea of within physical labor. So you see a guy there using a chainsaw, cutting some wood, as well as these 2 fellas on a beam. They don't look very safe, frankly. But the idea here is that it's long been known that organizations have an obligation to try to protect their workers and reduce the risks when and where possible. And so it begs the question, in our line of work, which in industrial psychology, they would call our work emotional labor, which I'd never heard that term before, but I like it, which is defined as emotions sold for a wage. And I know it's a little stark, but this is also true for people in retail, that the expectation is if somebody's interacting with you and you're working in retail, you don't have the option of being nasty and being angry at them, and at least you shouldn't, right? It wouldn't make you a very good retail person. So this idea then is, if we're part of what we bring to the table as mental health workers, are we bring a certain emotion and a certain expectation of being in a certain emotional place. So what are the dangers of this kind of work? So these are certainly not all of them, but these have been true in my life over the years. I find there are times when this job is extremely high stress, when I'm working with somebody that may be suicidal or dangerous to others. There are times where it's just miserable work, right? That you've got to do things that are really unpleasant. There can be, at the organizational level, you can work with folks that have low commitment. We can be experiencing poor treatment outcomes. There are things called vicarious trauma and compassion fatigue, which are byproducts of working with people with really very serious issues in their life. And that can have an effect on us. And one of the kind of umbrella terms you see in the literature is called burnout. And we're going to talk a little bit more about burnout. But one other side effect of working in this field for many of us is poverty. And I have experienced that quite a bit in this, in this field. There's other benefits other than money, but and you may think of other dangers of this job. I mean, there's sometimes real physical danger if you're outreaching folks who are homeless or drug addicted. Of course, those also exist. All right, so let's just talk about burnout because it's such a broad umbrella. Christina Maslak is the person I go to when I think about burnout. She's a researcher that coined or did a lot of the research in burnout. And she describes burnout as a reaction to prolonged or chronic stress and characterized by three main dimensions. The first dimension is exhaustion, particularly emotional exhaustion, where you're just like, oh my God, I just can't take it anymore. I'm wiped out. And then she says, in an effort to protect ourselves from any further withdrawal, further demand on our emotions, we begin to depersonalize those we work with, including our fellow staff people. And then lastly, our feelings of reduced professional ability. Right, and this is really the last piece of the puzzle when we're trying to protect ourselves, and in an effort to protect ourselves, we depersonalize and distance ourselves from not only who we work with, but the staff and clients. So that sounds pretty horrible. And sure enough, this construct of burnout has been really well studied, thousands and thousands of studies. And it's been found that the scale that Christina Maslak developed, the Maslak Burnout Scale, is highly correlated. So if you show burnout on her scale, you see also increased verbal and physical assaults of that person, which is fascinating. You see reduced quality of professional work, reduced job satisfaction. You see breaches in ethical conduct, lower productivity, increases in physical and mental health related problems, so anxiety and depression. Also a negative contagion impact on colleagues. I don't know if you've ever been called a contagion before, but maybe in the time of COVID, it's more common than it used to be. But I think many of us have seen this, where if you have a coworker that's experiencing burnout, they're really negative, and I don't want to blame them because they're suffering, but it's a serious situation. And then lastly, and maybe one of the most concerning things, is this negative spillover effect on home life. So people that are experiencing burnout at work are also having issues at home, including marital problems and drug and alcohol use. So burnout's pretty bad. At the organizational level, you see some of these same relationships play out with people that are burnt out with morale and what I mentioned ethical breaches, this kind of thing, organizational commitment and retention. The reason I bring this up is this is something that I've been personally interested in and studying. And sure enough, the study of organizational commitment, which is, do you feel that your organization supports you? Do you want to stay with this organization? Do you like the work you're doing? Are you thinking about leaving? And are you committed to your career? Let's say if you're a social worker or a counselor. All of these are highly correlated with burnout. So for that reason, it's a good construct. Now I'm going to send a bunch of materials, including the Maslak Burnout Scale and these organizational commitment scales, along with this PowerPoint. So if you're interested in these measures, if you even just want to look at them or take them yourself, they'll be available. And they come with a cheat sheet so you can score the scales if you choose to. So this is just some information on the study. It was about 1,700 people took this. And in our case here in New Jersey, in the state psychiatric hospitals, about 22% of the clinical staff came in as, levels that would be considered burnout, and 34% of the support staff, which is really interesting. Support staff are maintenance folks and housekeeping and folks working in the food service.
And Tom, because of the pandemic, because of the current pandemic, because of the COVID-19 situation, probably some of these high expressed emotion feelings, these are probably even for some people more prominent, because your level of stress that you get, even with your attempting to manage stress coming from above you as a supervisor and stress coming from below you, can become even more discernible and more impactful as well.
Yeah, you're making a really good point. It's exactly why I think this is such an important presentation, and this idea of restorative supervision is so critical at this time. So this slide is just talking about EE is emotional exhaustion. It's that it's the first dimension within the Maslak construct, and you can see it's highly correlated with all these negative things. So the other thing we found in studying burnout was that sometimes senior staff may be burnt out, but it's too costly for them to leave their job. And we call this golden handcuffs. It's a little less prominent, I think, in community practice and more so in civil service, which is our state hospital system, where the pension is part of the golden handcuffs. So this is from my mother. The plumber's pipes are always leaking, and my mother's father, my grandfather, was a plumber, so I guess she knew what she was talking about. I think what's hilarious, if you can see this picture, there seems to be an extra arm in there. So the guy is trying frantically to deal with a leak, and there appears to be an arm, an additional arm, so someone else perhaps is getting squished. So what does this mean? I've found that people that work in mental health are uniquely able to support others and be there for other people. But I think sometimes their pipes are leaking. In other words, we're not always the best at taking care of ourselves. I've heard this described as a wounded healer, where part of why we're doing this work is we have a wound, but we're not turning that focus on ourselves all the time. So part of my study of burnout and restorative supervision led me to this idea of a buffering hypothesis. And that suggests that the negative effects of emotional labor can be mitigated through organizational support, and particularly through this type of supervision that we're talking about right now. And so this is really, all of this was just a way to make this argument that this is really important. And it's not the only piece of the puzzle, but it's an important piece.
And one of our attendees, Wanda, talks about the inability to ask for help can be a response, a trauma response, and that is really, really important. Though, and we'll talk, I think, a little bit about vulnerability and the importance of vulnerability to supervisors and how to provide a safe environment in which to do restorative supervision with your supervisees.
Yeah, that's a good point. So here's another exercise. I encourage you again to use the chat function. I'm going to keep going because we've got a lot to cover, but just give some thought. Is there a self-care activity that you've been thinking about doing that you might commit to try to start, or something you used to do that you maybe want to get back to? I personally have a guitar sitting in the other room that I don't think I've touched in 6 months. So that's my commitment, just to go pluck on the guitar. I play the same five songs for 15 years. So that's about my level. All right, so go on to if you want to, go on to the chat function and just identify a self-care activity you might be willing to commit to give a try. Okay, so at this point, come to the second fork in the road, and this speaks to the first exercise, where it was the difference between your work life and your home life. The balance of personal and professional self-care. And this is something I never really thought much about. I was doing a similar presentation to this one, and someone said, right, I have personal self-care and professional self-care. And I'm like, oh, that makes sense. So let's just talk a little bit about what is the supervisor's role in staff resilience, in staff warding off burnout and this kind of thing. So it should be hopefully obvious to you guys. You're not, well, maybe you are therapists, but you're not therapists for your supervisees. And as such, it's not your responsibility to attend to your supervisees' self-care at home, right? That's their responsibility. And to some degree, their self-care at work is also their responsibility. So what is your role as a supervisor? Well, the research this Dewey in 2020 suggested that encouraging personal and professional self-care and giving a forum to talk about it is one thing that is within your role as a supervisor. And the next thing, providing information on stress management and encouraging stress management best you can. Promoting support from others. So we do a group supervision where we intentionally try to encourage peers to support one another. And also, and this is what Joe was referring to, encouraging open discussions about vulnerability. And this can be really important. I'll give you an example in just a minute about not only the importance of encouraging a place where people can be vulnerable, but why it can be so key to doing this kind of supervision. Before we get there, this is the model that I was exposed to just a few days ago, and I really, really liked it. And if you're interested, you can just Google the PERMA model. And it comes from this fellow Seligman, who's one of the fathers of positive psychology from the University of Pennsylvania. And if you're not familiar, positive psychology is the study of what makes us happy and well and resilient, as opposed to the study of what makes us ill, which is, if you think about it, it's really what the field of psychology has focused on, is illness and problems. And so in this model, Seligman says that these 5 dimensions, if we attend to them in supervision, and it could be as simple as, how do you guys, how do people, what's the best way to experience positive emotion in your life? What helps you with that? What do you feel engaged in? What is most engaging for you? playing guitar, or somebody said soccer. Somebody described, there's a book called Flow, and I can never say the guy's name. It's a really long, I think, Polish name. But it's a book about flow, where if you're a dancer or into yoga or ultimate frisbee, you can kind of disappear into the engagement of that activity. He goes on to say, and this one's pretty obvious, I suppose, but relationships are really critically important. And critically important now that we're all isolating. Are there ways you can reach out despite the social distancing? Can really make a huge difference. This one for me, meaning when I heard this, I realized that I had been hunkering down during this pandemic. I work at home because I'm a faculty for Rutgers, and finding myself just more and more just trying to avoid stress. And after I saw this presentation, I thought, I have to do some self-actualizing and try to reach out and find meaning and not just avoid stress, because it wasn't serving me. And then lastly, what do you find produces feelings of accomplishment? What are the things in your life that are making you feel like this is a job worth doing? And so for me, getting back into writing, and that I often feel a sense of accomplishment. So I encourage you to check out this model and even possibly use it in your supervision, because it fits well with this idea of a restorative approach.
And Tom, one of the things that I think Seligman talked about, and a number of others have talked about, is this idea that what you want to do in organizations is try to make resilience part of your culture. And the more you can make it part of the culture of your organization, whether it's developing positive connections with the folks you work with, whether it's kind of looking at change in a positive and open and flexible way, kind of viewing kind of when you in stressful situations, kind of viewing them as being kind of resolvable, and not letting them get the better of you, and kind of trying to foster staff awareness, not only of themselves, but what's going on around them. And one of the things that I think when you talk about PERMA is it's almost idea of it being a gift for you, and a way of showing not only gratitude for yourself and what you do, but for what other people in the agency do as well. So
nice. Yeah, it's a good point. I know many of the exercises that I find helpful are ones that focus on gratitude, as you were saying. And it kind of jolts me out of my Debbie Downer, woe is me focus. So here's pro tip number 3, and it's this weird thing about vulnerability, which I read in an article recently. The idea was that what it said was that vulnerability, like if you are willing to be vulnerable in a group, that creates trust, and that it's not the other way around. In other words, I can imagine thinking, oh, if this is a trusting group, they're willing to be vulnerable. So for example, if we were to do a round and we're going to do an update on how are we doing, for example, and I start by saying, I am just a mess. Like, I'm really struggling. I'm finding myself, I have a lot of anxiety and trouble sleeping. Me being vulnerable in that way says something to the group, that this group can trust more likely trust one another. So I encourage you, if you weren't familiar with this idea, keep your eyes out for this idea that if you're willing to be vulnerable, particularly as a supervisor, it can lead to a trusting group. Okay, so what are some exercises that we use to address this restorative function in group supervision in particular? The first one is called the chaos inventory. And I believe we go, yeah. So the chaos inventory, now we have, I think, quite a few people. Yeah, we got 35 people. So, but describe what this is. And if you're interested, you can put it in the chat. You can do this exercise, this inventory in the chat. So what this is about is the idea that when we're under stress, it can show up in areas of our life that maybe you wouldn't anticipate. A friend describes their car gets incredibly messy and they look like a homeless person because they just have all this stuff in there, not to put down homeless folks, in their car. Other people get, like myself, I get super clean and organized and tidy, like ridiculously tidy. And but these are really how the chaos in my life is showing up. It could be more concerning. It could be drug and alcohol use. I tend to smoke more cigars when I'm under stress. So if you're interested and willing, feel free to put in the chat, how does stress show up in your life? Maybe in ways that you're not always aware of.
And while we're doing the time, a couple of comments from someone talked about vulnerability is not being rewarded by employers, is often not rewarded by employers.
Interesting.
Which makes it really difficult. And again, that's that idea of it not being your agency, not being a restorative agency, if that's the case. Also, we're surrounded by people in our lives that are not helpers. So empathy may not be part of their lives or the way they work with, integrate and interact with people. So we may not get exactly the kind of response that we'd like to get from other people. And yeah, that's part. And you know, when we work with people with challenges in terms of their emotions, also sometimes we kind of feel that their inability sometimes to connect with us is not as satisfying as it may be, but that's part of who we are.
Yeah. Oh, I think that's really, really important, is that you always want to measure your willingness to be vulnerable. And also, you know, the question about, you know, whose needs am I trying to meet as a supervisor? If I'm sharing in order to support other people to share, that's probably a good use of that kind of approach.
And we've got some really good examples of these, of chaos. Stress eating.
Yes.
Hair trigger anger. Sadness. Obsessively cleaning. Oh boy, that would be real chaotic for me. Oh my goodness. Unhealthy eating habits and isolation. Sometimes, when you're feeling real stressed, you don't want to be around people.
Yeah, those are great. Jeff, Joe, go back and just check, are people willing to try anything new? Because we didn't talk.
People talked about meditation.
Nice.
You know, yoga and Tai Chi we did a program on Tai Chi in the hospital, which was very well received. And kind of in all kinds of self-care, the spiritual or meditative piece can be really, really helpful in reducing your level of stress and helping you to cope more effectively. Reading was another example. Another person talked about being more vulnerable. And that may have to do with the whole gratitude thing. And the other one talked about the supervisor as coach as well. So there are definitely, and by the way, earlier on, we missed a couple who talked about going out and hanging out with the horses. Nice. And kind of working at home and when it's the sun's not yet up. So Yeah, there's a lot of things we can do with oh, and someone just talked about a place where they let you break glassware in a soundproof room.
Nice.
There's a now there's a great idea.
Yeah, that's great.
Um, you know, um,
So here in New
and
Jersey, I just heard about this place. They let you throw hatchets that stick to a stump, I guess, and but it's the same kind of thing. It's just a visceral kind of feeling, I suppose.
physical illness, yeah, and physical illness is about just came up as another one, and being kind of increasingly pessimistic about
Yeah,
what goes on. I think part of the key is this idea of awareness, knowing where you're at, and not only being aware of where you are, but having some kind of things you can do
yeah,
to kind of move that mood to so you're feeling more resilient and you're able to have a go-to, some go-to things you can do to provide yourself with self-care. Whether it's the breaks we talked about before, or whether it is connecting with somebody at work.
yeah,
Your restorative practice, walking barefoot through the sand. There it is.
yeah. Connected with nature if it's not freezing outside, or even if it is freezing outside. Yeah. So I remember when I was first starting to explore this idea of restorative supervision and giving people an opportunity to, we call it reflective practice. But it's also a type of mindfulness. Um, and I just remember doing a round and somebody was talking about emotional eating, similar to what we heard earlier. And I realized that I had just ordered off of Amazon a big bag of assorted candy. And I had been eating it the night before. It didn't feel that well afterwards, but without really being mindful about what that was about. I just thought, I like candy, who doesn't? But really, it was part of the chaos and the stress of my life. And if it wasn't for that round I did with my colleagues, I'd probably still be woofing down candy because I did choose to try to identify a healthier alternative. So good. All right. So that's one exercise. The other thing is, and somebody mentioned it, I think, as a self-care activity or something I want to try or get more into, is this idea of mindfulness. And out of Toronto, Canada, they've been studying this for a long time, and they define it as an awareness of the current moment without judgment. And so many of my colleagues and myself have a practice. So every morning I sit and just try to be present and just see what kind of craziness flows through my head, and not try to adjust it necessarily. I do sometimes do thankfulness exercises, but this is the idea. And of course, there's a lot of material out there to support your mindfulness. And at the very beginning of the chat, if you guys want to scroll back, I put a link in at the beginning of the training, at the beginning of the chat, which is a link to the website that Joe and I manage. And there's just a huge number of mindfulness activities. There's also a huge number of free trainings in motivational interviewing and cognitive behavioral interventions and group facilitation. I think there's over 30 trainings, all free. So I encourage you to check that out.
Let me also mention that one of the great things about mindfulness is it's not something where you need to take an inordinate amount of time. I mean, I know you're really busy and you're moving back and forth doing this and that. It's the kind of thing where you can take a couple of minutes to kind of do some imagery. You can take a minute to do a breathing exercise. You could even just close your eyes and kind of space out a little for a couple of minutes to kind of refresh yourself and get yourself kind of back to where you want to be. So that's a fun, that's, I think, is a really critical in mindfulness. This idea is it's not something that takes, that you have to sit down for a 30-minute session. You can actually take a few minutes to kind of refresh and regroup.
Yeah, it's a really great point. One of the exercises I've been doing for years is focusing on my breath, so mindful breathing. And so I'll breathe in, I'll say, breathe in 1, breathe out 1, breathe in 2, breathe out 2. And I'm always curious to see how far I get before I space out. And when I'm under stress, I often get to 2. I mean, it sounds so silly, but I literally get to 2, and then I think I'm thinking about something else, some stressor or whatever. So I realize our website is right here on this slide, but it's also in the chat if you just want to copy it. So examples of mindfulness: mindful breathing, sitting, walking, eating, stretching, listening, seeing. I added pooping. My wife didn't appreciate that at all, but I thought it was kind of funny. And maybe it works, who knows? So this question then of what is the relationship of mindfulness and the restorative function in supervision? So mindfulness can act as a linking skill. And a colleague described this to me years ago when I was doing a skills group with clients at the state psychiatric hospital. And I was just so struck by how quickly they learn these skills, these social skills. And the research I had read was that it took many, many weeks for folks to learn these skills. And so I couldn't understand it. I couldn't explain it. And he said, well, you really established a linking skill in that they had these skills and they had atrophied and just not been used. And once you kind of identify that this is what we're doing now, they resuscitated these skills and were able to use them much more quickly than it's kind of the idea of rehabilitation versus habilitation. So mindfulness can act as a linking skill so that we can connect the awareness of the need to use this skill with having the skill. I know it sounds bizarre, but like, so many of us know that working out makes us feel better, but we don't work out, or eating particular food makes us feel well and eating a different food makes us not feel well. And so mindfulness gives us this opportunity to make a conscious decision to move in the direction of restoration or not. You know, of course, you don't always have to make that decision. So the research on mindfulness is increasingly powerful. That it takes time to and it's like a muscle. That if you practice mindfulness, you'll get better at it, and it can have real pay real dividends in your life.
Yeah, kind of builds self-awareness. I think that's one of the benefits of it. And when you build your own self-awareness, I think it kind of sharpens your awareness of what other people are experiencing and feeling as well.
Yeah, I was talking to a woman who's a nurse, psychiatric nurse, and she's been doing mindfulness exercises and meditation for 20 years. And she said that what she noticed was she spends less time being in a negative headspace. And she snaps out of it. You know, she becomes aware of it through mindfulness much more quickly, and then can make other choices and focus on gratitude or that kind of thing. And that was my experience. And now we all, you know, we're all at different levels, and there are days and weeks and months where I'm not so good. But I spend a lot less time in a negative place. So I take that as a positive.
Yeah. And the ability to look at your practice, I think, is so critical to both being a good supervisor and being a good practitioner. The idea that you can understand where you're coming from and where other people are coming from, it helps you to be able to kind of meet in a common place. So I think it really is critical.
I just realized I had my video on the whole time. I hope I wasn't doing anything offensive. But yes, agreed, absolutely. So here's another activity that we've done routinely. I learned this one in the dialectical behavioral therapy program we do at work at the state hospital. And it's just the idea of doing a round in a group supervision setting, and from 0 to 10, how burnt out are you feeling today? And it's not really technically the construct I referred to before, but it's just the more colloquial use of burnout. And it gives people an opportunity, if they're really not in a good place, they can, give you a high number, and we can, take efforts to support them and kind of unpack that a bit. I just did a supervision last week where somebody gave a really high number, and she ended up saying, I just really need to talk to someone, like I'm not okay. And she said, I really wasn't that conscious of just how bad I was feeling until we started to talk about it. So I think it served her really well. Some of the other, there's a whole bunch of exercises for team building. So there's nothing unique to these exercises. And I don't know that there's any best practices other than perhaps mindfulness. So we do a whole bunch of team building exercises, including interviewing one another in teams. And we've done this at the state psychiatric hospital. And fascinating, people, after interviewing one another, they said, I worked with this person for years and I never knew anything about them, really. Like they just had such a professional boundaries. So some of the questions we've used are, what are your hobbies? What are you most proud of? Is often very interesting. What's something about you that most people don't know? Do not know. And if you were not working here, what would you be doing? What do you most like about your work? Of course, if the person's burnt out, that could be a loaded question, I suppose. But we've had really good success with doing these kind of exercises and just promoting team building in general. Feel free, if anyone does a particular team building, if you put it in the chat, we're always looking for more good examples of things we can use. Okay, another example of a restorative activity has to do with self-care rounds. So similar to what we started with today, we do a round just saying how you take care of yourself and what's working for you. And if you feel like you're weak in this area, that we encourage a person to identify something maybe they're interested in trying, and use the group as an accountability buddy or accountability structure. And we've done this many, many times, and people now really look forward to it. And a lot of people confess, like, yeah, I didn't drink more water, which that was their goal. And interestingly, I was presenting at Rutgers, and a psychologist in the audience said to me, as psychologists, we know that we need at least as much caretaking as our clients. And I was just so kind of flabbergasted, because I thought, our clients need so much, right, often, and the needs can be so overwhelming. But I've come to really believe this, that this ability to turn that lens, that caretaking lens on ourselves can be just really, really important.
And I think, some of our panelists are responding also. The issue of, there's almost a dichotomy sometimes in terms of your expectations or people's expectations of you versus your expectations or unmet expectations of others. The kind of the idea that, we're expected to work really, really hard. And I think for a lot of people, this pandemic has really been really difficult, and people have ended up going above and beyond. And you sometimes do wonder whether or not these expectations are realistic, and whether or not people actually appreciate you for what you do.
Yeah.
And it is very tough, you work, then how do you separate your work life from your home life? You're working during the day, and then you got kids when you get home, and we really do need the capacity to provide self-care for each other, for ourselves, to really have some go-to again activities that we can to kind of move us out of it, because the stress becomes overwhelming. And you need resiliency, because resiliency is what helps you with the uncertainty. And I think when you go into work every day, there's a certain level of uncertainty, particularly now. And when you go home, there's a certain degree of resilient, of rather certain degree and
Certainty. Yeah.
of uncertainty. And you walk down the street, and there's a certain degree of uncertainty, or at least more than there was before. So you really do. I mean, and I just want to take this, opportunity to say to folks, you do a hell of a job, and it is a very tough job. And oftentimes we don't get the kind of validation that we feel we deserve. It's not an uncommon feeling. So the fact that you kind of do it and do it so well is really a tribute.
Yeah, it's such a good point. I mean, as I'm listening to you, Joe, this idea of giving ourselves permission for self-care and to think about what we need, it's just so important. Our culture often rewards kind of the martyrdom. Like, I stayed later, and actually as supervisors, we often model this, where you work harder than everyone else. But there are certainly dangers inherent in that. So it's a good point. So these next few slides are actually, yeah, you guessed it, slides. Yes, they're slides. Here's a green one. Kind of unnerving. Can't hear either. This always cracks me up. So let's do some pro tip review. So the first pro tip was the idea, these are pro tips for supervisors or administrators. The first pro tip is, if possible, to separate the support or restorative function from the accountability or normative function. And of course, this is because of the tension that exists between trying to have psychological safety and people to be vulnerable or capable and willing to be vulnerable, balanced against the need for accountability in this work we do. So that's a tough one, but that's pro tip number one. Pro tip number two is that vulnerability creates trust, not the other way around. And I heard you when you said that there are situations and groups of people where vulnerability is not the way to go, and that's okay. And then lastly, pro tip number three, which we didn't really talk about, but this is that what Joe described earlier, this idea that supervisors are in a really difficult position many times, where they're squished between their supervisees who need support and need their attention, and as well as being squished between an organization that may be making poor decisions, or right? Particularly now, and I don't even fault many of the people in leadership, because it's been so difficult to predict what the future is going to hold. And so I highly recommend that supervisors seek out other supervisors for peer support, or just seek out support through professional organizations, anywhere you can find it. We do a project here called Meta Supervision, which is supervision for supervisors. And I find it extremely helpful. And some of the other folks that attend it have said it's one of the best professional experiences of their life, because they really feel validated by their peers. So I can't recommend it highly enough if you can do it. And I know, people are time pressured in this field always. So with that, that's all we have for you today. And what time is it? We have just a few minutes. If you have any comments about the presentation, about this idea of restorative supervision, feel free to put them in the chat. I'm going to stop the sharing, and I'm going to, there I am. So I don't know if you can see behind me, but I'm in my workshop, and this is actually not a fake, that's real. And if you join us from some of the other sessions, I'm going to do an elf on the shelf, and I'm just going to move them around for each session so you can see if you can find them. So what are we seeing in the chat? Anything, Joseph?
Hey, excellent presentation. Thank you. Okay. And hopefully people learned a few, a few things. What we will do, by the way, is we will make available the the PowerPoints. There will actually be a recording of this actual presentation that you'll have availability to as well. So
if people are having trouble sleeping, they can watch this presentation
right.
over and over. Well, also
interesting, because someone said, hope more organizations take this on.
Oh, good.
Yeah, it really is. It really is critical. We find I'm doing some work now with a housing program here on developing resilience among staff, and we're starting out with the supervisors to try to give them some skills so that they can bring kind of this message of resilience to the staff, and we've gotten a lot of support from upper management, and I think again, resilience and what we're talking about today requires, as Hillary said, a village. Your organization needs to be a village.
Right, and I'm also respectful of the one person put in the chat, just this idea that professional webinars kind of set a high bar, and that they are absolutely correct that particularly now this work is really difficult when you are under your own kind of personal stress and COVID stress, and so I respect that, and I would focus on self-care and
yeah. One person wants to know if they can use a few ideas and statements in a class tomorrow.
Yep.
Why not? If something struck you as being important and sharing, we need to share this stuff, because I'm sure you're aware that many agencies aren't as resilient and don't make providing self-care for yourself as easy as they should. But what I'm going to task you with, though, is the next time you see one of your supervisees and they need to take a break, insist they take that break. Yeah, and just about everything in this presentation I stole from someone else. So yeah, you're free to use whatever you want. All right. Credit, that'd be great. But so I think that's the end of our time. Thank you so much, everyone. You were the safe. Best group I had today, by far. All right, turn off the video. All right, we recorded, so we're good. Yeah, I'm stopping the recording.